this story come out and to have the ability to have people see what this community, a small community along the Ohio River in the middle of the United States went through for decades to get information like this out to the rest of the world. And there were some incredible people involved, not only Mr. Tennant and his family, Joe Kiger, and his family and his neighbors, that really took on this issue, when it was not popular. This was one of the major employers in town, and a lot of people either worked for the factory or knew people that did. This wasn't a popular cause, but they really, persevered and sacrificed for the betterment of not only their community, but all of the rest of us, to make sure that information about this chemical that we now know is called PFOA, used in things like Teflon, that we now know this stuff has been used in so many products, in so many places all over the world for 70 years. It's not just Teflon, but it's stain-resistant, waterproof clothing and carpeting, fast food wrappers and packaging, firefighting foams. Just has managed to pervade the entire planet. And as you see at the end of the film, it's not a problem that just affected one family, one farmer in West Virginia, or even just one community, or even just one country. This is a worldwide problem. This chemical is now in drinking water all over the planet, not just the United States, but in the UK. I had the opportunity to go visit the UK when the film was being released in late 2019, early 20, right before the pandemic hit. And this stuff is used in all kinds of materials throughout Europe. And it's now in the blood of virtually every person on this planet, and our children that are being born. And unfortunately, a lot was known about the problems, the toxicity, and it was covered up and it was withheld. And it took 20 years of fighting to get that information out. And, unfortunately, people like Mr. Tennant he and his wife didn't even survive to see the rest of the world finally learning about this, and finally being at the point where we can now take steps to try to protect ourselves. Most of us never had an opportunity to do anything to prevent ourselves from being exposed, because we didn't even know this chemical was out there. We didn't know it was in these products. Even to this day, if we go into a store, we're not going to see this stuff on labels. We're not going to even know what products it's in. So at least information's starting to come out. Regulators and scientists across the planet are starting to get the information they need to be able to start protecting people. And I was really honored to be able to have the folks at Participant Media, an incredible Mark Ruffalo, who was so passionate about making sure the story came out, so that people don't have to go through what that community went through for 20 years, when they are now hopefully able to use the science, those big studies that were done, to be able to take steps now if we find this stuff in water wherever it is on the planet. So I was really incredibly fortunate to be able to have that movie made and brought out so that people can see the power of one person standing up, speaking out, demanding that something be done, and the power of a community getting behind them, and how important it is to have a story brought out to the public in a meaningful way, not only through the court system, but through the newspapers, through media, through television, through movies, so we can reach people and let them understand what they're exposed to, why it potentially is a risk, and let them make their own choices and start protecting themselves. So sorry for that long answer, but thank you. Thanks for allowing me to be here tonight to talk about it. I was incredibly fortunate to work with Mark Ruffalo and the folks at Participant Media. I was in the middle of trials, as you saw at the end of the film, and Mark actually had read the article in the New York Times Magazine, the lawyer became DuPont's worst nightmare. And Mark Ruffalo had been very active on water pollution issues. And when he read that story, he called me and reached out and really wanted to know how does something like this happen? How is this going on in the United States in modern times, and nobody's talking about this? Why is no media discussing this? Why does nobody know this story? What can we do to help bring this information out? And he was incredibly passionate and just a wonderful human being, and really was dedicated to wanting not only to do the story, but to do it the right way and to really stick to the facts and show as accurately as we could, what really happened and what real people had to go through in that community with the tenants and the Keigers, and what it was like to live through that 20 years. But at the same time, hoping to be able to show it in a way that helps inspire people to know it might be difficult, but it can be done, as we've been discussing. So I wanted to make sure that this was done the right way as well. I had a close relationship with the tenant family, with the Keigers, and it was incredible that they were able to I think those of you saw they were able, some of the folks were able to make cameos in the film. The Keigers were there. Unfortunately, Wilbur and Sandra had passed away, but Wilbur's brother Jim and his wife were there. We were able to do a screening of the film with the tenant family and others there in Parkersburg, because we wanted to make sure they were happy with how their family was being portrayed. And luckily we even had videotapes, depositions of Mr. and Mrs. Tennant and the others that the actors could watch, and they could actually see the mannerisms, how these individuals spoke, how they dressed, so that what you see on the screen was incredibly accurate with respect to what these people were like, what they had to go through. And I think they did an incredible job pulling all that together, taking a 20-year story and putting it into 2 hours. And so I really, I think we were incredibly fortunate to have somebody like Mark Ruffalo really be passionate behind this project and be able to team up with such an incredible group of participant media and the director like Todd Haynes and some of the amazing cast. I mean, it was incredible. And a lot of it was filmed in our offices in Cincinnati. So I got to be there and watch and help with certain parts of, how's a deposition done and where does somebody sit and how do they behave and who says what. So we really tried to make it as accurate and as possible, and really show what real people had to go through. Yeah, fortunately, we know that at least with respect to this chemical, PFOA, and the very closely related chemical called PFOS, the two that have the 8 carbons, attached to fluorine, the C8s. These are the two that are the most well known, the ones used in making Teflon, Scotchgard, firefighting foams. I know you mentioned firefighters and first responders. In the US, that's become a huge issue because those folks were using aqueous film forming foam, which is sort of a mouthful. That's called AFFF. It's a type of firefighting foam used to combat petroleum-based fires. Historically, used PFOS and had PFOA in it as well. Not only that, but the gear that firemen have been wearing historically were coated with waterproofing, stain-resistant type materials that had these materials. And because gear is so expensive and is used for so long, that stuff tends to break down and then could be in the dust of the firehouse, etc. So firemen, first responders, I'm glad that that's something that's getting a lot more attention. But with respect to the water, with PFOA and PFOS, the C8s, there's pretty effective technologies to filter it. And that requires a granular activated carbon system or reverse osmosis. They tend to be expensive for big municipal public water supplies, but they also can be very effective in capturing the C8s, the ones with these longer carbon chains. In fact, that's what's being used now in the public water supplies down in the Ohio River Valley. and they've been able to keep it down to almost below detection for the last 10, 15 years. Now, and that's also what a lot of municipalities, a lot of cities all over the world are now using to try to filter public water. There's also in-home systems that can be installed that would filter the water coming into the home if you're on a private well. Again, using that same kind of technology, but they can tend to be expensive. Not only the technology putting in the system, but then the operation and maintenance can be expensive, changing the carbon, paying to dispose of that. Now, as we have seen these newer PFAS chemicals, the ones with a couple fewer carbons, the C6s, the C4s, start to be used. We're also, as we see those being picked up in the water, unfortunately, we're finding that sometimes it may require more complicated, more expensive filtration systems. So again, luckily, in most of the places where this is being found in the water, it can be filtered out. It's expensive, but it can be done. Now, bottled water. There was just a report that came out in the United States by an organization, media group called Consumer Reports, that actually looked at a lot of the bottled water available in the US. And unfortunately, they did find trace levels, small levels, but still nevertheless there, of some of these PFAS chemicals in a lot of the bottled water. And again, it's because this stuff is so pervasive. It's really going to depend on where is the bottled water coming from. And if it's in an area that might be impacted, it's difficult unless that source is being filtered, to address that. And there's all kinds of concerns about even the packaging that this stuff is used in. So long way of saying, if it's in the public water, there are a lot of ways to filter it out. A lot of places are doing that. It could be expensive. Bottled water, it's technically some of this has been found in some of the bottled water. And there are folks that are now moving away from that, and companies that are trying to make sure that they eliminate that as well. The stuff is just very pervasive. It's everywhere. That's a terrific point, and one that I've tried to stress as well when I speak to different regulators and scientists is, we're not lab rats that can be kept in cages and bred so that we're only exposed to one chemical at a time. And unfortunately, that's the way a lot of these studies are done to look at chemical exposures and what effects they have. We're exposed not just to PFOA, but we're also exposed to PFOS, to C6s, to C9s, 10. We're exposed to all of them at the same time. And the concern is, what kind of synergistic effects do these have when we've got all of them mixing around together in us at the same time? So one of the things I think that folks are really focusing on now is we need to be looking more comprehensively at how these chemicals may be affecting us when they're all in us at the same time. And one of the other concerns too is, the 6 conditions that I mentioned that were linked to PFOA. You have to remember that science, that was all done back and finished up in 2012. It's been 10 years, almost 10 years. There's been a lot of additional science done since then, particularly looking at some of these related chemicals. And one of the things that folks are really starting to focus on is the ability of these chemicals to impact our immune system. And that's particularly scary and particularly troubling, particularly as we're dealing with the pandemic issues. Because one of the things that some of the researchers have been looking at is the ability of some of these chemicals, like PFOA, to decrease the effectiveness of vaccines, particularly in children. So if you go on the US CDC's, the Centers for Disease Control, ATSDR website, they even mention the fact that these are issues they're looking into right now. But again, nobody's really talking about that. You don't see much discussion about it. You don't see it on the news. You don't see the fact that we've got chemicals in our blood coursing through us, in our drinking water all over the planet, that may be decreasing our ability to fight off infections. You would think that would be a prime concern right now, but it's very difficult to break through and get that story out. Stories like this that are heavy on science and law and a lot of complicated chemical names, it's difficult to condense them into a 1 or 2 minute soundbite that is on social media or somebody can tweet out really quickly. Part of the problem here is these chemical names are so darn long and so confusing. It's not like arsenic, lead, things that people automatically know. You start talking about perfluorooctanoic acids or C9, C10s, and people's eyes glaze over. So finding effective ways to communicate about complicated science stories like this, particularly when there's so much at stake in our health-wise, is just incredibly important. So again, I really appreciate the opportunity to have events like this, because I think these are the kinds of discussions we all need to be having. We need to be doing it more often. Yeah, obviously we dealt a lot with the argument, oh, this is just the individual problems. They smoked too much, they drank too much, they ate too many McDonald's hamburgers, whatever the issue would be. We dealt with that in our trials when we actually were representing people that had cancer from drinking PFOA, and the company was trying to point to something else as the cause. That's almost always the argument you're going to hear. And I think, in this case, this is not like smoking, where somebody, makes a choice to pick up a cigarette, or they make a choice to pick up a hamburger, or they make a choice to eat 12 donuts, whatever the case may be. Here, none of us had a choice. None of us made this choice to be exposed to these chemicals. We didn't know we were being exposed. That information was withheld from us. In fact, much of that information is still not available. If you go on to company websites trying to figure out whether they are using these particular chemicals, because they haven't been regulated, they don't end up on a lot of warning labels. They're not necessarily disclosed. So even if you're out looking to try to find this information, you might not necessarily find it. So here, all of us were unwitting guinea pigs, where we were exposed without our knowledge, even though these companies knew if we make this stuff and we put it out into the world, it will end up in people's blood. It's inevitable. That's where it's going to end up. Nevertheless, kept covering up this information. It wasn't until lawsuits forced this information out that this information finally comes out. But a lot of folks still don't know, even realize these chemicals are out there. But this is very different from any sort of individual choice or individual lifestyle. None of us made this choice. And most of us, even if we're trying to make choices to avoid it, we don't have the ability to do that yet because the information still isn't there. And there are a number of companies, luckily, that are stepping forward and making very public announcements that they're no longer using these chemicals, or that they're going to switch away from them to other less, more environmentally friendly materials. But that's just beginning. So it's a difficult problem, but again, with these chemicals, it's a very different situation. None of us made this choice. None of us chose the lifestyle of PFAS exposure. Well, I think the one thing I would recommend is don't assume somebody is going to take care of this for you. Don't assume that just because you've got government entities, government agencies empowered to do things, that they will. It's as you see in the film, it's really incumbent upon each of us when we recognize a problem to bring it out and to demand that it be addressed. You can't just assume that hey, if this chemical can't be toxic, it must not be bad after all. I mean, for us, we're in the United States. Why, how could we be drinking water that's got some toxic, nasty chemicals? Certainly somebody's looked at this. No, that isn't the case. And so you've got to be prepared to insist that folks that are in positions to address public health, that they do it. And you have to be able to give them the information and the facts that they need. You can't assume that they're always necessarily going to have all of the data and all of the information. As you see in the film, and I talk about this, I wrote a book called Exposure as well, where I try to go a little more detail about what goes on between the big companies and the regulators. You know, they're kind of the revolving door. You've got to make sure that folks that have the ability to make important decisions about public health have all of the facts and all of the data, and are not necessarily getting it filtered or spun or, in some sort of spin by somebody on the other side. You just have to take some personal responsibility to get it done and to insist that it get done. And as we saw, it may take a long time. In this case, it took almost 20 years to actually not only get this information out into the hands of regulators, into the hands of the media, the public, but to then actually get people to act on it, to be able to review it and understand it, and actually then keep pushing. We're still pushing. In the United States, despite everything we know about this one chemical, PFOA, it is still not regulated at a federal level, at a countrywide level here in the United States. Despite all that's been known, all of these health studies, all of this data, we are still having to push and fight to get legislators and lawmakers to actually act on it. And it takes the power of engaged community members, working with your media as well, to keep the story alive and not let it get buried and covered up and basically fade away into the background. Those of you who've just seen the movie, you may have seen a clip from a show that aired in the United States called 2020 back in 2003. And think about that. That was a national news story talking about this chemical and the fact that it was in everybody's blood back in 2003. And then everything kind of faded away, went back into the background, and nobody talked about it again for another 10 years. So you've got to keep the pressure on, and you've got to be able to be willing to be persistent and keep pushing those issues. I think you really have to go in with your eyes wide open to realize this is going to be a long process. And you've got to be as persistent as the chemicals. You've got to be able to really know that this is not going to be easy. It's not going to be a quick process. And it can be done, though. I mean, that's the thing I'm hoping that people can take away from watching this film. There's a documentary on the story as well called The Devil We Know that I think is still available on Netflix, but showing a lot of the real people like Bucky Bailey, who you see in the movie Dark Waters, and his mother. To really, I think the theme that I'm hoping people can take away from the story is knowing it can happen. Change can happen. We're talking about a situation here where you had the most unlikely of competitors or adversaries, I should say. A farmer in West Virginia raising cattle who was able to take on one of the biggest corporations on the planet, and actually got not only was able to get this information out, but we were able to actually get the science confirmed. This is something, again, I address in the book in a lot more detail. Unfortunately, and at least in the United States, in our legal system, the burden is on the exposed person to have to prove whether an environmental exposure like this is causing you harm. The company doesn't have to come in and prove it's safe. They can simply sit back and say, you haven't proven it. You don't have enough science. What you saw in this film was one of the only times where a community was able to get together and actually get the science done, get massive studies done. And yeah, it took a long time. It took a long time. It took a lot of people coming together, 70,000 people. But nevertheless, it can be done. And it happened. And we were able to actually, because of that, get the laws changed. We're actually seeing laws being proposed now, not only in the United States, but internationally, to ban some of these chemicals, to restrict their use, to change public policy. And again, it's because people were insistent on making sure this happened. They didn't simply sit back and say, oh, we lost this particular court battle, or, oh, this is going to take 2 or 3 more years. You know, knowing we may have setbacks. There may be, we may take 2 steps forward and then 3 steps back, but eventually you get to that goal line. And here, I think, hopefully when people see this film, they realize it can happen. It happened here and it can happen again. People can make a huge change, no matter how huge the odds and how big your adversary, it can be done. Yes, it is continuing and is likely going to just expand as we find out that these chemicals have been used in so many different operations. And the sampling is just really beginning across the United States, looking for these chemicals in the water. And then now different people are trying to figure out where's it coming from. And so I think what you're going to see happen is a lot of additional sites, a lot of additional contamination areas are being identified. We actually have brought a new case at the end of 2018. I actually brought a case where we are seeking to represent everyone in the United States that now has PFAS chemicals in their blood. And the goal is to try to do, as you saw in the film, we set up this science panel to confirm what the health effects of this one chemical, PFOA, are. We did it through an independent panel that was confirmed, and people were able to then go forward and understand what those health effects are. Now, as we realize, it's not just PFOA, but it's PFOS, it's Gen X, it's all of these C4s, C6s, C8s, 9s, 10s, all of these additional PFAS are out there. And as we're discovering them, we're hearing the companies say the same things we heard when PFOA was being discovered. Oh, well, there's no evidence. There's no science showing that these cause any harm. You don't have any data to show this is a problem. Well, the idea is, well, if you're going to continue to make these chemicals and put them out there and use all of us as guinea pigs, you companies should pay for the independent scientists to do the studies to tell us what they're doing. So we're pursuing that case right now as well. We're waiting to find out whether we can proceed on behalf of the entire exposed population in the U.S. So I see these continuing, and as every day we're seeing this pop up, not just in the U.S. but in other countries as well. There's been a major PFAS contaminations identified in Belgium, in all kinds of firefighting foam problems in Australia, in New Zealand. There's PFAS contamination in the drinking water in Italy, in Germany. So it's everywhere. And I'm trying to do what I can to help make sure people have access to the information and the science about what we know, so that people aren't going to have to go back, start all over and redo all of this, that we can move forward based on what we already know, no matter where in the world this comes up. Thank you so much. This was a tremendous opportunity, and that those are terrific ideas. To have folks that can understand the chemistry, and I'd always recommend read the stuff yourself, read the facts, read the data yourself. Don't let somebody else interpret it for you or tell you what it means. Look at the data, look at the facts, form your own conclusions. So thank you so much for the opportunity to speak to everybody tonight. I really appreciate it. Thank you for watching the film, and I hope you will continue discussing this story. And it's a story that affects all of us. We're all in the same boat with this stuff. And thanks so much. I really appreciate it, and hope you have a good evening.